Now welcome back to Your Carolina. I'm Jessica Drew and I am joined here with Dr. John Lettieri from Carolina Plastic Surgery. Dr. Lettieri, you're going to talk to us today about some of the stuff you guys offer. You have an entire medical day spa and you offer quite a few non-surgical procedures. Tell me a little bit about those.
Yes, so among our array of procedures, which includes our esthetician, Kim Allen, who's a vital part of the spa, are injectable treatments, which usually I perform, such as Botox and Juvederm. And Kim has an array of chemical peels, medical products that patients use in their homes, or a combination of those, one of which is the Radiance Blue Peel, which we're going to see an example of today.
And speaking of the Radiance Blue Peel, this is something that people can do during lunchtime, so it's not some extensive chemical peel that most people think of.
More frequently, women, of course, are interested in what can they do in a short period of time. Literally in the middle of the day, they've got some time off, they'd like to get back to work or back to their daily activities, and this is one of those.
Well, let's go ahead and join Kim in the other room to see a little bit about this peel.
Designed to help women who may have photo damage from sun, age spots. So when they come in and they have a peel, it'll make their skin a little tighter, a little brighter, and a little smoother. When they first come for a visit, it only takes about 20-30 minutes to have the procedure done. They'll come in, I'll cleanse their skin, and then I'll use a solution that will make sure that all the makeup and all the oils are off the skin, and then I'll apply the peel solution. That peel solution is on for approximately 10 to 12 minutes, and then we'll remove it with the cleanser, and then before the patient will leave, I will apply their sunscreen, and then of course, if they would like, they can apply their makeup before they go back to work. What's so great about the Blue Radiance peel is that the patient can come in on their lunch hour, and they can have the peel, the process, the procedure done, and then they can return to work with no downtime. I would recommend 4 to 6 treatments for them to see the total efficacy of the treatment.
Thanks, Kim. Now, Dr. Lettieri, one of your expertise is breast reconstructive surgery. What kind of women have this surgery done?
Mostly, Jessica, it would be women who've had their breasts removed for some reason. Of course, the most common reason would be breast cancer. However, an increasing number of women are able to determine if they're at high risk for breast cancer because of family tendencies, eligible for preventive mastectomies. So still, they would have their entire breast removed. So for either of those reasons, either breast cancer or breast surgery to prevent cancer, these women would have breast reconstruction.
And when you do a mastectomy, can you reconstruct the entire breast?
Yeah, even creating a new nipple, the pigmentation around the nipple, so that women can feel as complete as possible after that surgery.
What is the most common type of breast reconstructive surgery that you guys do?
Yeah, around the country, the most common type is the use of expander devices and implants. The woman could have breast reconstruction at the beginning of their mastectomy experience and then continue it thereafter. But implant use is the most common overall.
Tell us about one of the newest developments in the implants.
Yes, the most exciting development probably in many years is the advent of the so-called cohesive gel breast implant, often called gummy bear because it's a very soft yet shaped implant. So it has a teardrop shape, and for women whose breasts have been removed, that implant becomes the shape of their breast. So it's highly effective, really exciting that we can offer that device. We're very fortunate. For the last 11 years or so, we've been using cohesive gel devices. They're not just for breast reconstruction, but almost exclusively now women are choosing one of those cohesive gel implants for reconstruction.
And do women have to choose right away if they want to have breast reconstructive surgery?
Yeah, it's a very good question. So patients, as you can imagine, being given a diagnosis of breast cancer are dealing with a lot of information. Decision for when to do breast reconstruction can be very flexible. Certainly many women do choose and are eligible to begin the reconstruction at the time of mastectomy, but it's important to make sure they understand it's not complete. Typically we can't fully recreate the breast at the time of their mastectomy, but it's also very valid, and it's best for some women to wait, have the mastectomy, and in a few months come back and have reconstruction. So the decision does not have to be made immediately.
Is it a very involved procedure?
For implant reconstruction, actually many women say it was a bit easier than their mastectomy in the sense that it's outpatient. They don't need drain tubes like they probably did for their mastectomy. So they're a bit surprised. It's more like having breast implants for cosmetic reasons, but we apply the reconstructive techniques and devices for their special needs.
All right, well, thank you so much for joining us, Dr. Lettieri, and we will be right back after this commercial break.